Good afternoon and welcome. It is my great pleasure and honor to introduce Dr. Michael Margolis today. Dr. Margolis has devoted his dental career to practicing healthy, holistic, biocompatible dentistry. As a member of the scientific group that got the CAVIT ultrasonic imaging team approved by the FDA, Dr. Margolis has been a leader in cavitational surgeries. As a graduate of Capital University in Washington and a doctor of integrative medicine, he has handled many complex dental cases in his career. Through experience, Dr. Margolis knows how important it is to keep impeccable dental records, especially in front of a dental board and also attorneys. Please join me in welcoming Dr. Margolis. Thank you.
Thank you. Well, good afternoon. I'll try to keep you awake because, you know, after lunch, you sit there and you go, just what I want to hear is record keeping. It's got to be probably the most boring thing anybody could ever look at until you're standing in front of your state board because the individuals that we get are not your run-of-the-mill individuals, think that they were wrong because they may have a pain, they may have a numbness, they may have greater expectations than what reality holds. So we're going to go over a few facts, and that is, we can get dental malpractice. According to a dentist benefit insurance company, 1.6% of dentists face a civil malpractice yearly. Average payout, $81,000. Plaintiff lawyers attempt to use a negative dental board result as a tool to leverage a settlement or civil lawsuit. These are public records. So what you find out is sometimes you get this ethical attorney, because we know all attorneys are ethical, will go through board results and pan it out and approach some of these people to see if they'd like to sue their dentist. And if you're in New York, California, Illinois, Arizona, and a few others, if you're a biological dentist, sometimes there's a little target on your back, and they start looking at those people and saying, hey, this is the guy we want to go for. So they look for the board complaint, a civil action can take place, and boards generally will tell you that your records are inadequate before they even see them. They'll tell you that the patient history, charting, x-rays, daily entries, and everything else, failure to refer to a specialist, lack of signed treatment plans or prearranged financial arrangements. And so they'll take that negative dental board result and use it against you, because as a dentist, if you get a result from a board that's not complimentary, you still have to sign it if you want to go back to business. So it's a business decision more than if you really agree with the board, and they're going to try to use that against you. So the legal worries go with the statistics reveal that you will face 3 to 5 legal actions in your career. Biological dentists, if you're doing cavitations and things like that and removing root canals, try to double or triple that. You'll have dental malpractice, civil cases, board cases, demand letters. So are you going to be next? Be prepared. So the importance of keeping daily records. Mr. Tanner is a devil or dental advocate, and he's been in front of juries. The last case that he had, a gentleman died during the deliberations of the case. His traditional dentist just happened to miss his oral cancer. Now, I don't know how many of you will look in the mouth and check under the tongue, back in the retromolar areas, and down the throat, and see if that patient has cancer. Pull the tongue out, go back and forth, and feel along the sternocleidomastoids. If you don't do that, shame on you. Second, if you don't record it, it was never done. So you got to do 2 things. Not only do you have to look for these things, but you got to record it, because the juries said, if it's not in the chart, it didn't happen. If it's not in the chart, it did not happen. If it's in the chart, then it happened. Let's face it, there's no way in heaven that we're going to be able to put down everything that happened during that appointment. So the first part over here, the front desk information and things like that, we're not really going to go over today because we don't have that much time. but you got to know responsible parties and things like that. The back office is where I'm trying to focus in on this, because it's your assistants that are going to seat the patient. They're going to take a blood pressure and they're going to record it. So what you're going to have to do is follow a different system to see, or a system that you make up that is consistent, so you know the 5 principles of what you're going to have to do. But there are other important contacts. Your front desk could get a complaint that they are fielding, and the dentist never hears about it. And they never contact us, and sometimes you have a very good intentioned person at the front desk who says, well, I don't want to pressure the doctor, and they don't tell you. So in November, I had my left knee replaced. In December, I had a kidney stone surgery, and in January, I had a kidney stone surgery. Meanwhile, I had a patient file a concern with the front desk, and they never told me because they thought I was under too much pressure already. And then what happens? She turns around and files a complaint with the board because I didn't answer anything. I didn't even know about it. Prior to that, and it's reflected in her chart, she and I talked on the phone 10 different times on different things concerning her case, and it's a very strong thing to be able to put in front of the board and say, wait a minute, she could call me all the time, but she never complained to me, not once. So you want to have your telephone contacts, after-hour calls you want recorded, staff communication, notes in the record, insurance company contacts, consultation with other doctors, referrals to other doctors, make sure you got all their pharmaceutical scripts in there, letters, referral information, did they ever show up? And then the last part, which I find I do more and more, laboratory results with other doctors, because I do a lot of surgeries and I want to make sure that they can clot. So over here, it doesn't really matter. On the left side, we're showing that there's initial visit, restorative visit, crown and bridge, surgical, and whatever there is. That's brought forward from the front desk, and they're going to enter the patients in the computer, establish patients, any changes, responsible parties, insurance, health information and alerts. Did it change? And always put down if a patient missed an appointment. The back office is going to be looking at a whole bunch of things. Your initial exam is going to be different than your regular visit. You're going to have a date of entry. We're going to show you later on slide 14, a sticker, and it has health medical changes in your history. Ask a patient. The chair side should always ask the patient, what are we going to be doing today? Some patients are alert enough to sit there and say, well, if you don't know, I'm going to leave. But they should know what they're having done that day. Because if they think you're going to be doing a filling on number 5 and you're doing a crown or you're extracting a tooth, they're going to have their expectations way down to the bottom of the chart because they think you don't know what you're doing. And unfortunately, sometimes the front desk doesn't inform the back desk. So that way you can go in there and you repeat today's treatment, and if there's a different answer, put down that the patient was unaware that they were having a filling today. Is that okay with you, Mrs. Jones? And if it is, write it in the chart. Are there any other concerns that you want me to tell the doctor? Not only is that a very important question for communication, but that's your future income. Because you might have not known that they broke a tooth or that they have another concern. They're grinding their teeth or sleep apnea. All these different things go there. Take a blood pressure and record it. Get that in there. And then over here, take an oral screening every time they come in, except during a consultation. If they're in the chair, check it. Because as they were saying to the one doctor, if we have time at the end, I'll answer all questions, I promise. But at the end of your oral cancer screening, at the end of that trial that I brought up earlier, the patient died because the guy didn't look in the mouth and it was never recorded. It was a $1.8 million settlement because the man was dead. And the family got the maximum from the insurance company, and the doctor was responsible for $800,000. All he had to do is look, and he didn't. Any unusual events, and if there's something that occurs in the mouth or you see something weird, take a picture. Most of us have intraoral cameras. If you have mirrors and a good 35mm camera, that's going to work because a picture paints 1,000 words. So course of action, signed treatment plans with fees listed, emergency routine. Treatment plan has been accepted, all payment arrangements been made. So the back office has got to make sure that all these things are done. Now, sometimes the payment's at the end of the appointment. When I'm doing surgery, we take the payment at the beginning of the appointment. And then the next visit's always listed, evaluate. Always have a next visit. In dentistry, there should never be a point in time that the patient doesn't have a next visit unless, one, they're moving out of town, or two, they're leaving because of one other reason like insurance or whatever. A sign-in sheet. These things are really important. You want a date, you want their name, responsible party, you need an adult to sign. And this brought up another thing that's not in this presentation that you should think of. If somebody is a minor, you must have permission, written permission by the parents if somebody else brings them in. So what we do at the beginning, when they go through their initial appointment, we ask who else might bring your child in who has permission to make decisions. And don't let them go out shopping during the appointment. We had a new patient come in, kid's 12 years old. We're doing their cleanings and everything. I go out to get the parents. They're across the street at the grocery store shopping. They're supposed to be there so we can ask questions. So that's really important. Time management's important for you. Time is money. So you want to know, are they on time? Are they waiting 30 minutes to be brought back? Any changes in any of their medical histories? Are we getting our patients back? And legal complications. Anybody have a family that ever gone through a divorce? And we had a parent complain that they said that they took us to the dentist, but they didn't really take them to the dentist. They're just trying to run up a bill. Well, we had the sign-in sheet from that day with the signature on it. And we also have routers or whatever. Routers is how we bill from the front to the back and back to the front and all that. So what's important is we were able to show the hand signature, time, and everything else in that situation. So here it is. You can get this, and I have, by the way, AGD disclaimer, I do not have any financial interest of a product in my talk or any companies offer me to grant money for this continuing dental and medical educational program. So you can go to Medical Arts Press, and those things rip off. You put it on the top of the piece of paper that you're sending back that you can take your notes so you can bill somebody. So it tells what time they come and you know when they're leaving. So over here, this is really a complicated form. We took labels for envelopes, and they're printed out like this. Any change in your history. This is in the patient's handwriting. So we go through and we have a date. They say yes, no, print, and signature. And if the answer is yes, the assistant is going to talk to them when they're sitting them down. Oh, I noticed that you have a change in your health history. They print it out for me so I can read their handwriting. And then I review it. I initial that I reviewed it. And then I put down any changes I might do. We don't use epinephrine in any of our injectable anesthetics, but most people who have this, they sit there and say, every time I get a shot, my heart races. So then we can reassure them that there's no epinephrine. They feel a little better about that. So over here, this is what our form looks like, and it's a legal document. Up here, we want to make sure that they know who we are. We welcome them. How many times do you say thank you to a patient? They're a customer. They're paying your bill. They're putting your kids through college or paying for your new car. Thank them. Tell them that you're happy that to help them, they're here. Try to make sure that your office has a name and logo, something that sets you apart from the community. Then what you want to do is you got all the basic information for patients. Then you're going to have all the information for the responsible party. And in the state of Arizona, we have to put down, this is brilliant, all services provided by an Arizona licensed general dentist. That's the law. We have to have it on all our advertisements, and you have to have it in your treatment chart or patient information that you have done that. And their handwriting is all over this form. So we hit what the law is telling us we have to do. Most dental offices lose patients due to insurance changes or if they move away. Always record conversations with insurance people, telephone numbers, and person's name, customer insurance benefits, and stuff. So this gets a little tricky. So we did a form that basically shows how to do this. It tells you the waiting period. It gives you the patient's name, social security number. It tells you the effective date of their insurance. It says if things are covered, what deductibles, percentages. So you have a time and date. We turn this over for all telephone conversations. When we do the initial stuff, the rest is always entered in the regular chart. But we have their phone number, their extension, the person we talk to, and the notes of the conversation. By the way, the insurance company does the same thing with you. So over here, we have an insurance disclaimer, and this is really important when we look at this. Each fee is individual for an individual patient. So we do not render our services on the basis that insurance companies will pay our fees. We tell them there's going to be a copay and they might not cover everything. You are responsible. I can't tell you how many times people come in who, one, the insurance check is sent to them and they keep it. But we get a copy that they've gotten and we call them up and say, oh, we never got that. So we contact the insurance company, ask for a copy of the check along with their signatures on it, and we tell them you got 24 hours to come pay for this or we file a claim of fraud on your part. Some of these checks can be very hefty, and when you get 20 people do that, it can affect you. And, you know, we're rendering services directly to them. They are responsible for the payment. You have to have this in your form if you're practicing where there's insurance. So now we get into the medical treatment, and we're looking at serious illnesses in 5 years, all these other fun things, non-prescription drugs. And God knows, most of our patients are on every homeopathic possible, and you want to make sure what they're taking. Record any information patient is receiving from a medical doctor. You may call the medical office and speak with the staff or physician. When I'm doing surgery, I want to know a lot of different things, and bisphosphonates are a real problem. You know what I call a patient on bisphosphonates? The patient I'm referring to an oral surgeon today, because I don't want to deal with the complications. So you have over here for women, another fun thing, are you taking birth control? Got to check that. Are they pregnant or nursing? You get their height and all that stuff. Do you currently take or have taken bisphosphonate drugs? Had a woman come in. She was in pain after this terrible oral surgeon pulled out this tooth and it never healed. And we went through all our information, but we didn't have this one line there. And I said, what other drugs have you taken? And she already paid me cash for the service. And as soon as she said that she had taken Bonevia, I turned around and gave her back her cash and said, we can't help you. And we sent her to a naturopathic physician in Phoenix, Arizona, who works with bisphosphonate and other patients who are toxic from drugs, and they do detoxify these people very, very well. So it works nicely for them. And we also have this. If a woman is taking oral contraceptives, antibiotics may disable a birth control pill. I've had 1 or 2 women come in from other offices and tell me that they got pregnant even though they were on birth control, and they had this massive infection and they were on antibiotics. And like I said here, and just for your help, on this slide, pardon me, these are the names of all the bisphosphonate drugs. You should know these so you will be able to intercede on their behalf, but you do not want to be doing bone surgery on these people. And generally what we do is a CTX test, which my son, who's an oral surgeon, tells me is not reliable, but it shows the rate of bone being turned over and if they're going to heal or not. But you really want to be careful. As we continue with this, we have their health history, and you have to look at all the fun things that we always see, allergies, and we usually see a lot of people allergic to metals. Then over here we have the dental history, popping, clicking, your standard forms. And as we continue, we look at payment policies are clearly stated. Why do patients usually complain? Because it's expensive, and if they owe you money, Sometimes they think they can get out of it, and this is why you do this. We're talking about changing the $25 charge for every half hour or $50 an hour, because that doesn't cover anything for you. But it tells you that you can have a finance charge of 1.5%. Goes through everything here. By signing below, you indicate that you have read all the foregoing and understand the same and agree to dental services being rendered in accordance with the foregoing. So we basically have an agreement with them that they're going to pay for their service. So as we go, there are some 5 transitional steps from the front office to the back office that's going to help your doctor make sure that everything that you're supposed to do that day is going to get done, recorded properly, and performed correctly. So if you have an update on the history of the patient, you ask the patient, record update, any new instructions, RXs from their physicians. Ask the patient, why are you here today? Record their answer. Even if they got it right, they know that they're here for what's going on. Is there anything else bothering you? So that's possible for future work. If there are no other concerns, write down no other concerns today. Your boss knows, your doctor knows that you asked that question. Always have a blood pressure, pulse, and sometimes you might even have oxygen saturation. And then, I can't stress this enough, OCS, oral cancer screening, record results. And so, the 5 steps, come on, let's go, are done, and then all paperwork is filled out, entered in the office computer from the front, HIPAA, make sure you got those. Patient is taken back, x-rays, all medical. This is your front desk job to do, and now we're into the back office, initial office visit. Make sure you have a complete radiographic series. If your patients are concerned, there's a great homeopathic called radiation from Dr. Doc or something, and you give them 5 drops. It helps the radiation be peed out of the body, and it's called radiation. And they're a homeopathic drop. It's great. We take photos of the patient's face, smile, upper and lower arches, and side bites. Why? Because if I'm going to do a presentation on them clinically later, I want to have good pictures to show before and after. And it's also very good to be able to show other doctors and boards what you've done. Oral examination is performed by dentists and/or hygienists, or a combination of both. Record all missing, decayed, restored types of restorations. If it's a metal filling, we want to make sure that we have, if it's an amalgam or some other gold, we want that. What type of implants, any dentures, removables, any observable cysts, abscess, soft tissue abnormalities, and other conditions. If you take a look at a patient, you lift their lip, and on the frenulum you see this little tissue tag, you know automatically that they got a digestive problem. Take a picture of it. If you see a deep groove down the tongue, you know they got digestive problems. What is it when you look at the tongue and you see that it's scalloped? Is it a spleen deficiency? Could it be that they are a sleep apneic, choking to death while they're asleep at night, pushing their tongue forward, trying to get air in through their throat? And prior to starting work in the patient's mouth, have them rinse with mouthwash, get rid of some of those germs. It's really a great practice. Plus, it makes the patient feel a little better right off the bat. So oral exam is performed. Periodontal probing and classification of periodontal health, case 1 through 4. It's not that difficult. We were all taught this in dental school. Everybody should know it. Oral exam performed by the dentist. Oral cancer screening, maybe you've heard that before, is noted and recorded, either positive or negative. If there's a concern, many times what I'll do, and in the last, so far this year, I've referred 3 people to a friend of mine who's an oral surgeon. He might not know how to take a tooth out appropriately in my consideration of removing the bone and getting the periodontal ligament out, but he certainly knows a lot about cancer. And so I send him over, we take a picture, we send the picture with the patient, we show where it's noted. Not only am I doing the right thing for my patient's health, but he's now liable and I'm not. So I like that. And so does he, because that's good business. So, what happened to you? We have a consultation discussion of findings. More information must be given to your patient. They might not understand the full scope. Explain or review blood antigen testing. I use Clifford religiously. It's something I've done since 1994. As a biological dentist, you may need to explain what you do differently than a traditional dentist. I've got a slide presentation that I do for about 20 minutes with each patient, showing what teeth do what to the body, so we have the tooth meridian chart. But I even go further back into the physiology and the structure of the jaw, the teeth, the periodontal ligament, the inner making of the tooth, how the odontogenic cells relate to the body, and I also talk about Dr. Steinman. And from this morning, you can see very clearly that tooth decay really is not tooth decay. It's a systemic disease caused by a change in the pH of the body or the terrain. And if you haven't looked that up, look at Dr. Steinman. It's really amazing what he's done. Over here, I have a disclaimer. I stand out. I'm different than a traditional dentist. The Arizona State Board of Dental Examiners, other dental boards, state boards, American Dental Association, the endodontists, the oral maxillofacial, the Academy of Periodontology, and North American schools do not agree that past extraction sites, root canal teeth, or ADA-approved restorative materials, dental amalgam mercury fillings, can be harmful to a patient's health. Dr. Margolis believes they are. So right there, I'm telling them I'm different. I had a state board ask me once, do you tell them that you're different? Not only do I tell them, sir, but I have a date, they print their name there, and the assistant signs the paper. They are in there at that time. There are no claims by treating any of these conditions will improve a patient's overall health. You can't say that. It doesn't work that way. We don't know. We have a pretty good track record. So here's an entry for a patient. We have the date. Mr. Smith states he is here for routine cleaning. His concern about losing filling in his lower left tooth does not hurt. So that's the change that he's concerned about. We have a blood pressure or pulse. Patient presents for routine prophy, moderate calculus, lower linguals, generalized plaque. Patient states he's not been taking good care of his teeth, pocketing in lower 4 to 6 millimeters. The patient does not like to get numb. So she went ahead and, without local anesthetic, just cleaned these 4 teeth here and the rest of the mouth, scaled, polish, exam. After that, I should have put down that she had a laser treatment. He had a laser treatment. But we have no change in medical history, the date, he printed his name, and a signature, and then the hygienist's name goes there. At that point, I came in and we looked, and I checked for the OCG. And then I saw that this is broken. We recommend a full porcelain or zirconium crown. Check allergies with 2 E's with Clifford and treatment plan. And you can use BioComp also. Presented, accepted, and signed treatment plan. From there, we were able to schedule this. On the other page, the other slide, I showed that he scheduled for a 3-week checkup, and then we did both at the same time. And then over here, we have a computer-generated thing. This is when it's presented. Here are your codes. These are the things: oxygen, a mask. We have a x-ray there, and then the procedure. We always put down that there's a buildup for every crown done. Rarely do I ever do a buildup. Usually don't need it when I'm doing full porcelain crowns, but I still have it in there in case I need to. And so I told them, you know, this is the worst case scenario of what it's going to cost for that day on that tooth. So it's all presented to them. They sign the bottom. Here it is, the same treatment plan, describes the service, expense, and patient does not have insurance, so there was no problem of trying to figure out who was going to pay what. And then when they come back and we don't do a build-up at all, it's $300 less. They love you. And so we get the signature, and everything's fine, and everybody's happy. But on that, we have a consent form that Dr. Margolis and Dr. Kovar, my other doctor, is recommending that you replace existing restoration. Whenever an old restoration is replaced, the patient must be informed that there are risks, and we talk about nerve damage. We also talk about the tooth could have a problem with the nerve later, crown lengthening, talk about the procedure there. There's a separate charge we talked to them about. Commonly reported reactions to local anesthetics. We talk about every bit of this with them. They sign it, and it just tells them that, you know, complication can occur. So it's informed consent before the procedure is done. And so over here, we have this. We do not use epinephrine in patients' anesthesia. Well, if I get epinephrine, I have to go out of my room and get it in another room. So I'm pretty safe with that. Patients signed the treatment plan with consent, and then we went ahead and we used a rubber dam, separated IAOMT, mercury removal protocol utilized. And so he was dressed up, we were dressed up, and we prepared the tooth. Pentamix, we put in temporary temp phase, seated ultra temp, bite, adjusted bite, patient tolerated procedure well, seat crown. Usually we get a little thing back, a sticker from the lab, and we put that in the chart saying the type of material that the crown is made out of. And then we have the doctor, whoever did it, will sign that. So it has the date, it's got his blood pressure, and we had a change in his medical because he had Azor due to an increase in his blood pressure. So it's doing its job, the pulse, the amount of anesthetic, and just go through the other thing, and everybody was happy. But we hit everything that we're looking for on those 5 different steps that I talked about. Patient said, I'm here to have a filling done. This is a woman called Anita Martini, and if you met her, you'd need a martini, I promise you. You have the date, you have a change in her medical history, and so patient has no other complaints, and I don't know why I didn't type in over here because I'm the one that types these slides. So we had to put in something there for, I got to find out what it was. We use a rubber dam, separate oxygen, routine protocol, and then remove decay, broken down. So we say what we're doing, EVO, tetric flow, EVO, composite, just bite, contours. I could